Take this free practice test to see how prepared you are to take a Paramedic (EMT) certification exam. Question 1. The first step in treating a patient who may be experiencing a cardiac arrest is to take his or her baseline vital signs. True, false? In cardiac arrest, the priority is immediate chest compressions and defibrillation, CAB, not taking baseline vital signs. Question 2. Which of the following patients would need a rapid trauma assessment the most? A young woman with a gunshot wound to the chest. An elderly man who is conscious, but who is also complaining of severe chest pain. A teenage boy who is unconscious, but who has no obvious injuries. A middle-aged man who has fallen from a height of 5 feet. A gunshot wound to the chest is a high priority, life-threatening injury that requires immediate rapid assessment and intervention. Question 3. What is the first step you should take when you start to size up a scene? Find out how many patients you need to treat. Determine the safety of the scene. Do a body substance isolation, BSI. Determine the mechanism of injury. Standard EMT procedure begins with BSI, body substance isolation, precautions before assessing scene safety. Question 4. Which of the following is the first step you should take in treating a medical patient? Determine if the patient has any allergies. Find out what medications the patient is taking. Ask about the patient's pertinent medical history. Determine the patient's signs and symptoms. Assessing signs and symptoms is the first part of the history-taking process, sample, for a medical patient. Question 5. You are assessing a patient who is breathing, but he or she is doing so very slowly. What is the proper term for this form of breathing? Apnea, bradypnea, tachypnea, dyspnea. Bradypnea is the medical term for an abnormally slow breathing rate. Question 6. The first part of conducting an initial assessment is to get a general impression of the patient. S. True, false? The primary /initial assessment begins with forming a general impression of the patient's condition. Question 7. Every squad should contact dispatch a certain minimum number of times on every call. What is this number? 4, 5, 6, 7. Typically, dispatch is contacted 6 times, dispatched, en route, on scene, transport, at hospital, and clear. Question 8. Which of the following is the proper way to treat a child with a mild airway obstruction? Apply abdominal thrusts and back blows. Immediately provide transportation to the hospital and do not agitate the child. Do a finger sweep. Try to relieve the airway obstruction. For a mild obstruction, the goal is to keep the child calm and transport. Intervention like thrusts is for severe obstructions. Question 9. You are assessing a diabetic patient who is conscious, but extremely confused. You are unable to determine whether the condition is hypoglycemia or hyperglycemia. What do you do? Immediately transport the patient to the nearest medical facility. Administer 4 dextrose. Monitor the patient for changes. Administer oral glucose. When a diabetic's status is unknown, it is safer to administer oral glucose because it treats hypoglycemia and is unlikely to cause immediate harm in hypoglycemia. Question 10. What is the most important condition that must be met for an EMT to assist an angina patient who wishes to take his or her nitroglycerin? The EMT must have medical control. The patient's systolic blood pressure must be above 100 mm Hg. The patient must be experiencing severe chest pain. The nitroglycerin must be administered sublingually. Nitroglycerin is a vasodilator. It cannot be administered if the systolic blood pressure is below 100 mm Hg as it may cause dangerous hypotension. Question 11. A detailed physical examination is only performed on unconscious patients. True, false. A detailed physical exam is also performed on conscious trauma patients with a significant mechanism of injury. Question 12. You are assessing a stroke patient and are trying to determine if advanced therapy will be effective. What is the critical factor you need to determine? Is the patient experiencing receptive aphasia? Is the patient experiencing dysarthria? When did the patient's symptoms begin? All of the above. The timing of symptom onset is critical for determining eligibility for fibrinolytic, clot-busting, therapy. Question 13. What is one thing you should not do when treating a patient with an acute abdomen? Clear the patient's airway. Attempt to diagnose the cause of the problem. Administer oxygen. Monitor vital signs. EMTs provide supportive care and transport. They do not attempt to diagnose the specific underlying cause of abdominal pain. Question 14. What is the third step of conducting an initial assessment? Determine the patient's level of consciousness. Assess the patient's airway and breathing. Identify the patient's chief complaints or any life-threatening conditions. Assess the patient's circulation. The sequence is 1. General impression. 2. C-spine stabilization, if needed. 3. Determining level of consciousness, ARPU. Question 15. Which of the following is not considered a part of the patient's signs and symptoms? Environmental emergencies, behavioral issues, the patient's last oral intake, obstetrical conditions. Last oral intake is part of the sample history, not a sign or symptom, which are what you see or what the patient feels. Question 16. A patient's vital signs include his or her capillary refill time and breath sounds. True, false. Capillary refill and breath sounds are essential components of a patient's vital sign assessment. Question 17. Which of the following is not a part of the upper airway? The nasopharynx, the carina, the oropharynx, the pharynx. The carina is the point where the trachea divides into the bronchi, making it part of the lower airway. Question 18. What flow rate should a nasal cannula have? 1 to 6 lpm, 1 to 4 lpm, 3 to 6 lpm, 4 to 6 lpm. A nasal cannula is typically used for low-concentration oxygen at a flow rate of 1 to 6 liters per minute. Question 19. What should you look for to determine if a scene is safe to enter? Environmental problems, such as unstable terrain, heat, or lack of light. Hazardous substances or dangers like downed electrical lines, broken glass, etc. Traffic from civilians, law enforcement or other rescue personnel. All of the above. Scene safety involves assessing environmental hazards, chemical/physical dangers, and external factors like traffic. Question 20. When treating a patient with a medical condition, the first thing you should ask is what medications he or she is taking. True, false. The first step in medical history is determining the chief complaint, not the medications. Question 21. What oxygen concentration can a bag valve mask, BVM, supply? 80%, 90%, 100%, 95%. When connected to an oxygen reservoir and a high-flow oxygen source, a BVM can deliver nearly 100% oxygen. Question 22. What is the final step you should take when performing an initial assessment? Assess the patient's circulation, make the transport decision or identify which patient is a priority, assess the patient's airway and breathing, determine the patient's level of consciousness. The primary /initial assessment concludes with prioritizing the patient and making a transport decision. Question 23. A patient you are treating has just lost consciousness. What is the first thing you should do? Open the patient's airway, assess the patient's breathing, do a physical exam, obtain the patient's vitals. In an unconscious patient, maintaining a patent airway is the absolute first clinical priority. Question 24. Which is not part of the lower airway? The larynx, the trachea, the epiglottis, the bronchi. The epiglottis is a structure located above the glottic opening, making it part of the upper airway. Question 25. A 90-year-old woman is having an acute ischemic stroke. She is conscious. What should you do? Administer oxygen and transport at once. Perform an exam. Obtain the patient's history. Check the patient's vitals. Time is critical in stroke management. Providing oxygen and rapid transport to a stroke center is the priority. Question 26. When you arrive at a scene, you should be careful to not enter it with your emergency vehicle. True, false. Positioning the vehicle safely ensures it does not become part of the accident scene and remains accessible for transport. Question 27. What are the most important things to notice when doing a rapid trauma assessment? Pooling of blood around the patient's head, torso, or extremities, abnormal angulations or holes in the patient's body, bruises or tears to the skin, all of the above. Rapid trauma assessment looks for DCAP-BTLS, deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, swelling. Question 28. You must follow protocol when using the radio in your emergency vehicle. Which of the following is not required by this protocol? Press the push to talk button and wait 2 seconds for the carrier frequency to establish the connection. Monitor the frequency for several seconds to be certain it is not currently in use. Hold the mic approximately 2 inches from your mouth. Transmit all pertinent information about the patient to the hospital using coded language. Modern EMS protocols favor plain talk over coded language, like 10 codes, to ensure clear communication. Question 29. The last step in a detailed physical assessment is to manage any secondary wounds. True, false. The detailed physical exam is when secondary injuries are fully assessed and managed after life threats are addressed. Question 30. Where do you begin a detailed physical examination? The patient's head, the patient's chest, the patient's neck, the patient's abdomen. A detailed physical exam is typically conducted in a head-to-toe sequence.